Assalamu alaikum, everybody, and a very good morning. Am I audible to everyone?
Yes.
Perfect. So, very good morning or afternoon to everyone. My name is Rabia Khan, and I am the career counselor at the City School Raksha campus. It's a pleasure to welcome you all to this important and insightful session. Today, we are diving into a conversation that is close to all of us, understanding autism and anxiety and how we can create more supportive, inclusive environments for those navigating these experiences. And it is my absolute honor to introduce our distinguished speaker for today, Ms. Rabia Khan, a highly experienced clinical and counseling psychologist with over 10 years of professional experience in Pakistan, UAE, and the UK. She holds a master's degree in clinical and counseling psychology from BMU and is affiliated with top professional associations such as the British Association of Counseling and Psychotherapy, the Pakistan Association of Clinical Psychologists, and the American Psychological Association. Her career has included roles as a well-being advisor, lecturer, consultant psychologist, and instructor. Ms. Khan has worked with leading institutions like International College of Portsmouth, Beacon House National University, Pulse Therapy Center, UAE, and various autism support centers. She has designed impactful professional development programs, including a comprehensive 90-hour teacher licensing course in the UAE, as well as courses on autism, intervention, applied behavioral analysis, and special needs education. Her passion lies in building greater awareness, training, and support systems around mental health and development conditions, particularly autism and anxiety. So please join me in welcoming Rabia Khan. Thank you so much. To begin by getting your work, can you share a little bit about your personal journey? What has led you to focus on supporting individuals with autism and anxiety?
Yeah, thank you so very much for the kind introduction, Rabia. Of course, our names are similar, so that's going to be a challenge throughout the webinar, but that's fine. So coming to my journey altogether, of course, you've talked a lot. I'm really honored that, I've been invited for this particular opportunity. I've been given this particular opportunity and I'll be, speaking about my journey altogether. So my journey actually began after my graduation. I started working in one of the schools. It's a very renowned school here in Lahore, it's Oasis Trust, which basically specialize in structured teaching programs that are used with autistic children, autistic children, and it's a purpose-built campus where they're going to provide them with all sorts of opportunities and basically a place to thrive, rather than focusing on their deficits altogether. So that basically, of course, in theory, while I was doing my master's, I knew what exactly the symptoms are. I was also sure in terms of assessment, because in hospitals and in placements, you do get to see certain clients, with these symptomatologies, and you get to diagnose them. But at the same time, I wasn't really, to be honest, in hospitals, they never come for intervention. They go to clinics or therapy centers, or maybe, you're going to see some mild cases in schools. In mainstream schools as well, or inclusive schools as well. So that's how my journey actually began. I specialized, I got hands-on training in structured teaching programs, and that gave me a different perspective altogether, that, rather than focusing on the deficits, because when you're going to a doctor or a psychologist or anyone, where you're seeking help in terms of, something related to your health, you're always looking at the problem, and how to actually diagnose the problem and how to deal with it and coming to a cure. So with these little, tiny kids, these lovely children, what I saw was that, we're not looking for a cure here. We're looking for understanding. We're looking for a different perspective. We're looking for their way of understanding the world. So it's just about, each of us being individual in terms of our perception, and it can be considered as a different culture, that, their way of understanding the world, their way of looking at things is completely different. I am going to highlight a few things if, in the audience, people are not aware of it, that what exactly autism is, but I'm going to come to that later. So that's how my journey actually began. Then it brought a lot of curiosity in me to understanding them more in detail. And I read upon that. I got, certain, privately I got trained. And then, of course, there came opportunities. I started working as consultant with renowned institutions in Lahore. I got the opportunity to work in, provide training in Dubai. Then I moved to UK, and of course, the journey never stopped. And then, I continued with that. I worked with one of the schools, and I have been teaching for the past, I think, now it's been 10 years now. So I've been teaching for the past 10 years. So yeah, that was also one of the things I was really, really passionate about. So I continued with that, and I worked with different academic institutions as well. And currently I'm running my own training institute with the name Institute of Professional Advancement. And, I'm really glad that City School has collaborated with us and, given us this opportunity as part of our autism awareness campaign. So yeah, that's about my journey. It hasn't been a very long journey though, but yeah, I am learning throughout that. And coming to what exactly are the things I would say that that are really that really made me a lot interested in this particular area, because you get training in everything, adult psychopathology, child psychopathology, but why this specific disorder? Why? Now the reason why was that I found a lot of uniqueness in it. I found that it is, yes, there are certain core features. For example, you by in theory that these individuals, they tend to struggle with expressive language, they tend to struggle with understanding non-verbal cues like gestures, like jokes. They're going to take everything very literally. They do struggle with social conventions like body proximity, how much do you have to maintain that, and usually on the outer surface they appear to be very disinterested in social communication and developing or maintaining any relationships. However, if you understand their perspective of doing things, it's just that they really struggle with this area. That's a core deficit that they have. So if they don't, for example, if I go to a mall and everybody's speaking in French or in Persian and I don't know the language, of course I'm not going to participate in that. And also, this is the first symptom that really made me curious. That okay, now they don't understand my way of things, so why not understand their way of doing things? And so it was a very non-directive approach that made me very curious about things. Coming to the second point, of course, there are three core features of it. Second point was that, the repetitiveness. We tend to see them being very inflexible. We see that they've got very restricted interests. I'll share an example that one of my clients, he was a big fan of Spider-Man. And I had no knowledge about Spider-Man. I never watched any of the movies, any of the films, because of course, you've got your own interest and he got his own. But it was so difficult in the counseling session to actually bring him to a point to talk about something. He would just talk about Spider-Man and lose interest in me as an individual because I didn't know anything about his interest. So I actually had to learn about it, just to maintain that conversation, just so that I can build that relationship with him. And we end up being friends. Not exactly literal friends, you would say, but it's that relationship, because I was interested in something that he's interested in. And that has a shared, and for communication, this is very much required. We tend to be friends, we tend to have people, relationships in life with people where there are common interests. So sometimes that thing might not be of interest to you, but you do have to, in order to build that relationship, you do have to see what are the strengths these children are having. So there are restricted interests, but again, I would say that inflexibility can be dealt with if you bring some flexibility within yourself. And the most challenging thing that was of interest to me was the sensory part of it. Now the sensory, it's like a challenge. To be honest, that if you go to, I'm sure that Eid was just, a few weeks ago, it was Eid and, the festives and all the celebrations. And if you go to the mall, I mean, it's actually a very awful experience for me personally, because I find that very suffocating with the overload of sensory. Yeah, it's kind of overwhelming with the sensory information and all sorts of stimulation. There is noise, there is sound, there is visually, it is crowded. So it is overwhelming. And for them, it's like a day-to-day experience. For some of them, I would say that, for some of them, like a doorbell wouldn't be something very significant for us. It will be very bearable for our ear, but for them, it will be a bang. And they'll run away from that. So that was something that I was really interested in, that what are the profiles? I mean, what exactly is this different sensory profile? Because that really plays a role in terms of their adjustment in the usual or in the norms that we set for these children. For example, in school, there are bells ringing, there are children shouting, walking, running. For one child, for whom it's very unbearable, you'll see them running around away from school. It's not that they don't want to participate in anything. It's just that, the overall sensory experience is just so overwhelming. So yeah, these were some of the things that made me really curious in my journey. That I really want to study that more in detail. What are their ways of doing things? Because on the outer surface, they appear just like other children, but very disinterested in you.
Very true, very true. And Shakti, just developing on that question of yours, for those of us who may not be very familiar with autism or anxiety, would you explain this to us, because these two often intersect for many individuals? Could you briefly explain how exactly they intersect?
You're very right on the point that they're very closely linked, and many autistic children, they tend to experience very high levels of anxiety. That is again, the root causes of it are something that lie in their sensory sensitivities, I would say. It's the adjustment part of it. It's the physiological reaction or physiological arousal that triggers their anxiety. And sometimes, it also lies in their limited communication abilities. Because, just imagine yourself that I ask all of you to actually make a height-wise line. If you were there in a physical room and I asked you to make a height-wise line, but don't use your language. Now, language is a very, very important tool. We use that to seek information. We use that to share information. We use that to protest. We use that to, in a lot of ways, we use that in a very meaningful, it's very purposeful to use language and just get done with it. For them, what happens is that the journey is completely different, because for them, their limited language abilities, and sometimes even, they're going to be different levels of autism that you're going to see. For some children, they're going to be completely mute, the language hasn't developed yet. For some, they're going to have limited language, a one-word speech, two-word speech. But that speech is just so limited. Like they would say Baba, Mama, Dada, but not with the intention to actually call them. It's just repetition that they're doing. Just recalling what they've learned over the period of time. It's something that they find interesting, right? And then there could be sentences as well. But the difficulty lies where they want, for example, they want water, and they're continuously saying mama, 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 and not even able to point towards that. And the caregiver all of a sudden is picking up each and every object except water. So that is where anxiety actually, it lies in their sensitivity and also in the limited communication ability. That makes it a lot difficult for them to communicate, to let them know. And sometimes caregivers or parents could also try to dodge them. For example, if a child from somewhere they picked a knife, for example, that's not a safe thing to give it to them. They won't try telling them, they won't try communicating with them. Rather, they would see a child who's insisting and they would try to hide it, and that is where the fixation becomes just so difficult to deal with. Now they're going to be like, okay, if I see, and this is where that concept of no and never comes in. That for them, they can't predict that if it's a no right now, it might be a never today. I might not see this object ever again, and that is where the resistance comes in. So they will be very resistant to get their way out of it, because they don't know when exactly is the next time they're going to see that object. It might just be gone forever. So that is exactly, the reasons why there is high levels of anxiety in these children is based on their hypersensitivity, where they tend to be stimulated by different senses very easily, very quickly. The threshold for different sensations is very low. And the second is the limited communication abilities. Apart from that, there is also a biological side to it, where we say that the part of our brain, there is this brain part which basically detects threat or stores fear related memories. So that part is overstimulated, and that is also one of the reasons biologically. And also another thing, if we look at the scientific side of it, is that the auditory processing system for some of the individuals is very slow. So what happens as a result of that is that I'm going to give an instruction to a child, and while the child on their own pace is processing that information, I would just, as an adult, lose patience. I would give in another instruction, and then another instruction. It's like 3, 4, 5 instructions being processed at the same time, and we see the child just lying on the floor crying because they're overwhelmed. So yes, they are very closely linked, but the roots of it lie in the deficits and the problems that we face. We first need to provide intervention for that, And then, of course, we can move forward with seeing that if the anxiety level is extremely high, because there are 40% chances of these individuals developing phobia, social anxiety. There are different disorders that they can coexist with autism. So we have to deal with that once we've dealt with the basic symptomatology causing anxiety.
That's completely right, Rabia. And moving on to a question that stems from that question actually is, what are some common misconceptions people may have about autism and anxiety? How can we better understand these experiences? How can we identify this in children? Because it's not very easy to identify. Sometimes we, like you said, symptoms could coexist, right? So how do we, of course, the formal assessment can only be made by a psychologist, but if we were to identify it initially, how do we do so?
Okay. So, answering the first part of your question first is that, of course, when it comes to misconceptions, there are a lot of misconceptions, to be honest. Right now, with awareness, we see the first misconception being that the student or the child who hasn't developed speech, they need to be assessed for autism. Not realizing the fact that, some children can have a speech delay just in isolation as well. I mean, speech is not it is one of the symptoms, I would say. It's part of the symptoms, but it's not solely the only symptom. Then, of course, you need to consider the whole profile. You need to consider how if the child is not able to speak, that doesn't mean that, they fall under the spectrum. Rather, if the child is able to, hold your hand, there are other ways of communicating, using non-verbal cues to communicate, who physically taking you to the object. That means the child is communicating. It's just not able to develop that language and use that in the most effective way. That's the first misconception. Second, eye contact. Even if, it's very difficult even for me to maintain eye contact while I'm speaking. Makes me overwhelmed. It's not that, I'm on the spectrum in any way. But again, this particular part has been removed from the criteria as well, because it's a normal thing. People tend to get socially anxious when they're looking into the eyes, and they tend to, for a person like me, I tend to forget what I was about to say. So I prefer, moving here and then. You must have seen that right now as well. So yeah, this is something that usually people would say, and they would try to correct that, which is something very difficult, because a child is visually hypersensitive. A visually hypersensitive means that it will be like a lot of things. They're receiving that information in very high intensity, unbearable for their eyes. That is why they're preferring to concentrate without actually looking at things, and we try to correct that. Why do we try to correct that? The reason is that this doesn't fit our social norms. For communication, you need to face the person and then probably speak. So it's not about, that person, it's not about the challenge the child is facing, it's about our mindset. What we need to correct here. That's not a symptom of autism, not having eye contact. Yes, not responding to your name. That's a fact. You need to check that in detail if the child doesn't respond to their name. And also identify. Sometimes what happens is that people, parents would come and say, the child is not responding to their name. Now their name is, for example, their name is Harun, right? And we call them Honey. How is the child going to identify that his name is Harun? So you're calling him by the name that the child has, but you're not calling him with that name all the time. You need to see if there are multiple names that you're using. You're using baby, you're using Baba, you're using Honey. You need to be very consistent as well. So that's also one of the things that need to be addressed. Also, another thing that is a misconception, and that is that they're not interested in developing relationships. They're in their own world. They're not interested in us. They're not interested in developing relationships. No, that's not the case. It's just that, they feel misfit. We expect a lot from them to fit in. We expect them to have the language. Whenever they try to communicate, we feel that, okay, he's using this word, maybe try again. We're making that social appropriateness that we expect from them. We're making it very difficult for them to adjust. We're making it an anxiety-provoking experience for them.
True, very true.
And that is one of the reasons why they would run away. Who would prefer anxiety? I don't prefer anxiety. I'm sure you won't either.
Of course.
As a
Yes.
survival response, we would just run away. We'll be like, okay, we're better off without it. So challenging, so difficult to communicate, right? So that's also one of the misconceptions. And also, an important thing. Sometimes I would see parents, and that's very distressing to see as well. But of course, they can't help it. And that is, they would look for root causes.
Yes.
Yes. And there's this new terminology that we see as virtual autism. I mean, I haven't really read very detailed on it as well, but that is also one of the terms that exists. That probably, with a lot of screen time, that's going to have an impact or probably develop autism altogether. And sometimes people think that autism can develop in any age. No, that's not the case. That's also a misconception. It cannot develop in any age. You need to have a history. You might have seen a lot of children having all these symptoms that I've mentioned in the early years of their life, and they grow out of it. They're considered as features, right? But in the first 5 years of a child's life, you need to have these symptoms that give an indication that this is the thing. And probably with intervention, the symptom, of course, the severity might change over the years, but then again, the existence, or it cannot be that a child faced a trauma and all of a sudden he developed autism. No, it's a neurodevelopmental disorder. While the brain was developing, the anatomy was also affected in some way.
True, very true. And Rabia, sort of building on that, because I understand there are so many misconceptions, and I feel that it is also a major lack of awareness in at home, in schools, or the workplaces. So how can we, as individuals, create more supportive environments for individuals dealing with autism? Because as you just mentioned, it is a neurodevelopmental disorder. There are so many things that are happening with them. How can we, as individuals, create a more supportive environment for them at every level?
The first and the foremost thing is about perspective. Rather than just thinking about the cure. Now, these neurodevelopmental disorders, intellectual disability, autism, learning disability, don't have a cure, 100% cure. If somebody is guaranteeing that, I'm sure you need to rethink on those options. That's not the case. If we're going to run after the cure, and if you're not going to accept certain things that help them regulate, it will be very difficult for them to fit in the social norm, and it will be very difficult. I mean, we're just making an effort to just banging our head against the wall, making it difficult for the child. So there are a few things that require acceptance. One of the things is that, sometimes I feel that, and not exactly I feel, but, some of the things that I've observed over these years, and that is that, for example, their body rocking, their hand flapping. Now, it is just like, how some people like moving their feet while they're thinking. It's just like that, but that's considered as a good.
Nobody notices. They're so
Nobody
busy to do something, but you don't notice.
Yeah, but for a child who's rocking, that's stimulating. Now, that is their way of regulating with their anxiety, because they find back and forth movement. If it's not harming anyone, if it's not harming the child, it's just based on the social perception that we want the child to stop doing it. So we don't want the child to self-regulate in the way that they're regulating themselves. And we're not even providing them with the opportunities. So it is very important that, with children who've got a different sensory profile, they need regulation quite frequently. And in different ways. For example, if a child is there are two types of sensitivity profiles that we see. Either a child is going to be hypersensitive, where little amount of stimulation is going to make them really stimulated, and they would try to run away from it. Or a child is going to be hyposensitive. That means the child requires a lot of stimulation for their senses to be stimulated. I'll give an example of it. Just in COVID, when our sense of smell was gone, I would smell everything. I would smell the perfume, the strongest ones of them, just so that I can feel, because I felt deprived. I knew what the experience looked like. But then I felt deprived. I was like, what exactly is happening? Will I get it back? It was causing me a lot of anxiety. So one of the things
Of
is if a
course.
child is hypersensitive and you see them seeking sensation everywhere, for example, touching things, for example, walking barefoot, that means they have got a different profile. We need to provide them with that sensation to keep them regulated. So the first and the foremost thing is that, having a sensory diet. If they're in school, if they're at
यार ये
home,
किस
they
तरह
need
के
a
कमेंट्स आ
sensory
रहे हैं
diet.
अर्षा?
They need to get their
जरा
sensory
देखो
profile assessed by an occupational therapist
फेसबुक पे
and provide them what is required so that they're not hyper aroused all the time. If they're hyper aroused all the
पढ़ो ये
time,
कमेंट्स
they won't be able to concentrate on what you're asking them to concentrate because they're just so overwhelmed and engaged with their senses. The second most important thing is that you need to understand that rather than just relying on their expressive language or their slow auditory processing system, we need to give them alternatives. Alternate way of instruction, alternate way of communication. Now, an alternate way of instruction would be providing them with the visual, providing them with the real picture. For example, you're asking the child that, okay, do you want apple? Do you want apple? And the child is not responding, having a real picture card. You want this. Huh? So rather than just testing their memory, provide them with, facilitate them, accommodate them as much as you can so that they're able to communicate to you. You can use that anywhere. You can use that in school. You can use that at home. That's the easiest thing to do. Will make your life a lot easier. I remember we used that symbol based system with one of our children, and we introduced those visual schedules in school. And instantly, the child, he would just use his behaviors. He would run outside, and everybody would be like, no, it's his outside time. Rather than giving him a predetermined or pre scheduled time, we'll be like, okay, if he wants to go outside, doesn't harm anyone. It's okay. He can go and take a small break. Made our life a lot easier when we actually implemented the visual schedule for him because he used to pick up that card that this is outside card. I need to go outside. This is what I want. So if we would ask him, what do you want? He would run away to his schedule. This is what I want. That is how you make them learn to communicate through visuals. So if a child,
Placards, I think, would help, or even slides would help.
yeah,
This would be good for them.
yes, use visuals. And in an overwhelming situation, I'll also share another example where a child was crying and crying in the corridor, and he was just crying because he soiled his clothes, and he was expected to actually go to the washroom and change. We were really struggling. We showed him all the visuals, but no, nothing worked. And he was just crying and crying that I don't want to go to the direction that you want me to go to. I don't want to go to that direction.
You know what? Yeah.
Yeah. All of a sudden, there was another child carrying a trouser, and he was just moving inside the classroom. He thought basically that is what made him understand that that particular he thought that the trouser is coming for him because he realized that there's something wrong that they're taking me to the washroom,
Yes, of course.
and he couldn't see the trouser there. So their connections are sometimes very fixated.
Yes.
And we need to be very cautious in terms of actually making them understand. And all of a sudden, we saw that child. He basically snatched that trouser from the other child. He was standing and he just started walking towards because he was like, why are you taking me to the washroom? You don't even have the trouser right now. I mean, what are we going for? So I don't know. That's unpredictability. So making things a lot predictable for them. The more there's going to be uncertainty, and it's the same with us. If I didn't know who my audience is going to be, if I didn't know how I'll be, if it was my just first webinar ever, I would have been really, really anxious. It's uncertainty because I'm not familiar with that. So I'm making them familiar with things. Yeah, these are some of the things that we can use as parents, as teachers. Very easy to use. You can use visuals. You can use, in terms of their sensory profile, identify what are their needs. For example, some children like to bite, and that's their jaws. Being hypersensitive, provide them with nuts. Provide them with alternate things that would just calm their mind. And of course, they need frequent breaks as well. And that's completely fine. Let's not test their attention span. Let's give them, breaks rather than them using their behavior. Give them what they want in a predetermined manner so that it makes your life a lot easier.
Very true. And Ms. Rabia, finally, what's one piece of advice you feel that you would want to give to someone who's sort of beginning to navigate their journey with autism and anxiety, whether they're a parent, teacher, or someone experiencing it themselves? What do you feel
Yeah.
is your parting advice for this?
Okay. One thing that I would say that, is that try to learn about it first. I mean, sometimes we get to hear a lot from the community in general, right? It's your child. It's your child, even as a teacher, it's important that you understand their needs. You understand what exactly the child requires. And and that is going to make things a lot. Try to develop that relationship with the child rather than just letting the child know what's right and what's wrong. Develop that relationship. Be that favorite caregiver that the child loves, and basically thinks that even if nobody understands me, this person is somebody that I can rely on. He knows what I want. So it's very important as a teacher to develop that relationship, develop that trust. That rapport building is very important. You'll achieve a lot instantly if you develop that relationship. And if you're unable to develop that, it's going to make it a lot challenging for you. And it's through indirective. Understand them, understand their routine, and sometimes giving them things that they like is all right. It's all right. Having some, having some flexibility in your boundaries. It's okay if it's
Yeah.
not harming anyone. Yeah, it's not creating a chaos altogether. So yes, as parents, I would say that they've got it is not. I wouldn't say that it is an ideal situation altogether, but learn about it and make yourself equipped. Don't just leave it on to the school,
Yeah.
on our therapy centers. Yes, learn about it. What you think as a parent is right. Yes, use that with your child. So it's your journey, and I mean, it's a different journey of parenting, but be gentle with yourself and
Yeah.
learn what suits you, what suits your child, what drains you. And therapy is very important for, of course, they have got a different journey. I would say that for parents, therapy is very important for their own personal, because it tends to cause a lot of burnout. And I
And
see
how
very less support groups for parents.
navigating this journey? It's not
Yeah.
easy. It's not an easy task.
It's like a parent who wasn't prepared for it, and they've been using you use the normal route to go to school, but you've been asked to go and identify another one because the route is blocked here.
Yeah.
So
Yeah.
well, that's completely normal. The anxiety is completely normal, but again, it's all right. One day at a time. You're going to learn. Your child is going to learn. They're going to be different things. But I mean, equipping the parents is very important because they spend more time with their parents rather than in this therapy center or in schools, I would say.
Perfect. Perfect. Thank you so much, Ms. Rabia, for joining. We will now be taking some questions. If anybody from the audience has any questions, you can type it in the meeting chat, and then I will be able to view them. All right. So, Ms. Rabia, we have one question. Kindly please suggest what the aggression such children feel, especially for caregivers like parents and teachers, because people around them don't really know how to react to it and how to manage such children. I know that you have briefly answered this and covered this, but just a little guideline on what exactly we should be doing when such a situation arises.
Well, that would need to remove them from that particular situation for that moment. Let's not make them learn something that is going to go a long way and they might practice that because it's easier for them to learn rather than unlearn. And yes, provide to them. Usually, sometimes we see a lot of aggression in children where they've got a hypersensitive sensory profile. But also, it's part of learning as well. Sometimes children would react when they move to teenage or when they're very young, very egocentric. They just don't know they want what they want. They would use any means of communication, their behaviors, they would hate, they would bite. But yes, it is important that you first shift them. Maybe you have to pick them up and take them to a different room. It is less stimulated. Yes, less stimulation, if and observe the environment. You over the period of time as a caregiver or as parents, you're able to identify what the triggers are for my child. For example, loud noise makes my child, it makes them overwhelming, or is it that a lot of, there should be less stimulation inside the room, and give them some time to process what has happened without any instruction. Communication doesn't work in these situations at the moment, I would
We need
say.
to change the environment at that time.
Yes, remove them from that particular environment which is overwhelming. Of course, with awareness we can help, we can let the people know that, where my child is having a difficult time at the moment, and I would need to remove my child from this particular situation. Not It is important both ways for your child, because he's really, usually when we have meltdowns, the child can react in any way, and it takes them time to actually settle,
Yeah.
right? It's not like a behavioral problem that would, you'll present them with a consequence and it will go away. It's a physiological reaction. It will take some time. If they're crying and crying and crying, so it will take them time to come back to normal, and they will come back to normal. But provide them with a space where there are less people, less communication, give them time to settle, and then probably just distract them onto something else. And the best way, I would say, that sometimes when you see a lot of resistance, it's providing them with a different alternate sensory thing that involves sound, that involves movement, just to distract them. So distraction is something, rather than communicating, distraction is something that tends to help.
Right. And Miss, there's one more question. As a school guidance counselor, how can I effectively support autistic students who experience anxiety, especially in the classroom or social settings? Are there school-based strategies or interventions you would recommend?
Yes. So in schools, make it more predictable for them. For example, if you see, you have to identify what the child's profile is individually. If you feel that what exactly are the triggers, you need to provide them you need to provide them with more opportunities to regulate. It is very difficult for them to actually, follow a particular, generally the root causes of their anxiety is following what other students are also following, but for them it's easier to regulate themselves during those activities. For these children, have frequent breaks, or have a schedule that is like, having a favorable thing, a semi favorable thing, a non favorable thing, something involving movement, something involving food, that helps them regulate their anxiety. So identify what their interests are, right? And if in midday you find that my child, this is after this, I feel that the child starts to, react to the environment, starts to show less interest, then we need to give them an hour or maybe half an hour, for at least 40 minutes, to calm themselves down, to burn their energy, maybe go for movement outside, just so that they calm themselves down.
Right. And Miss, there's one more question. How to manage these children as a part of a whole class of neurotypical students without a shadow teacher?
Okay. With this, you need to have resources, the right set of resources now. If you don't have a shadow teacher with you, there are mild cases which adjust very well in the classroom. And what you have to do for them is for example, if you've got a timetable, you need to have a visual schedule for them that is understandable and comprehensible by them, right? Rather than, and the seating arrangement should be so that, they're there in front of you, so that you're able to monitor them, rather than they're sitting with other children. Apart from that, you need to provide them with certain tools to seek help. So how does the child seek help if they need help? Providing them with communicative tools is very, very important. If the child is, hesitant in terms of initiating a conversation, so you need to provide them with tools, maybe a help card, something of this sort, maybe a small bell that, doesn't bang altogether, but something of the sort that, they are able to know that if I need help and if I need support, how am I going to seek that? Apart from that, modified versions of activities, right? And usually pair them with certain students who are very empathetic towards the problem, right? So that they're able to help and that develops their social relationship as well. So not very difficult. But yes, you're going to see a few challenges as well here as a teacher, because sometimes it's very difficult in a class of, let's say, 20, 25 students or more than that. One student, you're trying to help that student adjust, but have predetermined reinforcements as well for this child. So maybe the whole class is engaged in a particular activity that the child is not interested in. It's okay. They can do something that is of interest. For example, they don't like reading, right? Rather than going into the detail of why they don't like reading, maybe they can do something else at that given moment. Maybe they can color, maybe they can paint, and in a different corner, so that others don't feel that he's basically he or she is getting a special treatment.
Very true. We need to be mindful of the other students around as well.
Yes, yes.
Very true. Miss, we have one last question. How to control the sudden hyperactivity of minor autistic children around 10 to 11 years?
About around 10, yes, burning their energy levels. It's difficult for them to regulate that, involve them in activities, pre-scheduled, predetermined times where they're going for running, they're going for cycling, they're going for football, burning their energy. Because, that physical arousal needs an outlet. So you need to help them. And that's a very, very good strategy, to be honest. That has worked wonders with a lot of students. So I would say that having physiologically helping them burn their activity actually eases, because, teenage is that particular time where naturally they're going through the same sort of a growth spurt. They're going to, physically, they're going to have, the same development. Psychologically, again, it's going to be a challenging time. And then the core symptoms causing certain level of anxiety for them. So yes, burning their energy levels through different physical activities. Swimming is a very good, activity. Kung Fu, making them learn that. But the easiest is walking, walking, running, making it playful for them. And that would really help.
Okay. Thank you. Thank you so much, Ms. Rabia, for sharing your invaluable knowledge and experience with us today. Your words have truly deepened our understanding of this issue that a lot of people face, and it has been inspiring at the same time. So thank you so much for informing us about all these things. And thank you to everyone who participated today. Let's take today's learning forward and continue building spaces where all individuals feel seen, supported, and empowered. All right, we'll take your leave. Thank you. Thank you so much for joining, everybody. Allah Hafiz.
Yeah. Thank you so very much. Take care.
Everyone.